Jen.
Hi.
How is it going?
Okay.
It's very nice to meet you. My name
too.
is Dr. Perez. Thank you so much for coming in. I always enjoy seeing a new patient. How are you feeling today?
I'm okay. I'm feeling
Doing okay?
overall good. Yeah.
Good. So I spoke with our nurse, Sarah. Looks like she already got your blood. Okay, perfect. And were you able to leave a sample in the restroom?
Yes.
Good news. So the EKG did populate and everything looks good with your heart, okay? So no suspicion of any cardiovascular issues. Your blood pressure was slightly elevated from what I see. It looks like she documented 139/81, but nothing that I would say is really abnormal. Okay? So I'll go ahead and take these stickers off of you. That way they're not just irritating your skin for no reason. All right, so we can go ahead and move along with your visit. Just to let you know how it's going to function, I'm basically going to go over some of your medical history. I do have quite a few questions to ask you, given that you are a new patient. So I just want to make sure that we're obtaining as much information as possible. We'll then move into a bit of a neurological examination, essentially just testing your neurological function. I'm going to ask you a couple questions, have you repeat a couple of words. It's nothing difficult, very elementary questions, just making sure that your orientation is intact.
Okay.
And then we will move on to the physical portion of the examination. Going to consist of a couple different things, a bit of a cranial nerve exam. I'm going to test your cranial functions as well as some of the flexibility, okay?
Okay.
So if you have any questions or you'd like me to stop or you want to ask me anything, feel free to just let me know.
Okay.
So I'm going to start with a couple questions about your overall medical history. If there's anything you're not comfortable answering, feel free to decline. So are you feeling generally well or unwell today?
Well.
Good. Any current pain?
No, none at all.
Any undue stress?
No, it's normal.
Daily stressors?
Daily, yeah.
Okay. Any known medical allergies? Are you allergic to anything?
No, it's my seasonal allergies. That's
Seasonal
it.
allergies, okay. And no non-medical allergies as far as like food, fragrances?
Oh, no.
Have you always had seasonal allergies?
Yeah, pretty much.
Okay. It's the time of the year for that. It's the change of the season. Any previous surgeries in the last 5 years?
No.
Are you taking any prescribed medication?
Nope.
Any non-prescribed supplements?
Just
vitamins?
a multivitamin.
Multivitamin. Do you know what brand it is by chance?
It's just the regular store brand.
Okay. Any recreational drug use?
No.
Do you drink alcohol?
Socially.
Socially? Good. Any previously diagnosed medical conditions?
No.
Good. Overall pretty healthy. So moving on to a list of various symptoms, I'm just going to ask you if you're experiencing any of the following, okay?
Okay.
Any headaches?
No.
Migraines?
No.
Any onset pain or chest pain?
Nope.
Blurry vision?
No.
Double vision?
Nope.
Loss of vision?
Nope.
Do you wear glasses or contacts?
Contacts.
Contacts. Have you always worn contacts?
For quite a few years.
Okay. And do you feel like they're working well for you?
Yeah.
Do you have a regular optometrist?
I do.
Okay, good. Any issues with your hearing? Muffled hearing, loss of hearing?
No.
Any tinnitus or like ringing of the ears?
Nope.
Any issues with your nose? So trouble smelling, runny nose, stuffy nose?
Just because of the allergies right
Okay.
now.
Okay. Moving on to your mouth. Any gum pain or gum bleeding?
Nope.
Teeth pain?
Nope.
Any jaw clicking or popping like when you yawn or when you eat?
No.
Difficulty swallowing?
Nope.
Any issues regulating your temperature? So do you often feel too hot or too cold?
No.
Good. Any abdominal discomfort or bloating?
None.
Having regular bowel movements and urination?
Mm-hmm.
Good. Any signs of abnormal bruising? So do you notice that you have bruises and you're not quite sure where they came from?
Once in a while.
Every so often?
Every so often.
Okay. Are they fairly large or kind of small?
No, they're small.
Small, okay. All right. And lastly, any abnormal lumps or bumps that you've noticed anywhere recently?
No.
Okay, perfect. Any moles that you're concerned about?
No, none that I've noticed.
Good, okay. Overall, it appears that you are fairly healthy, so that's very good. So if it's all right with you, we will go ahead and move into our neurological examination, okay?
Yep.
So I'm going to have you repeat a series of letters. If you could repeat orally A-E-I-O-U.
A-E-I-O-U.
Very good. Can you repeat car, call, and cow?
Car, call, cow.
Very good. I'm going to give you 3 words to try and remember, okay? So the first word is table, basket, notebook, okay? I'm going to have you add a couple of numbers for me. So can you tell me what 6 plus 6 is?
12.
Good. And 7 minus 5?
2.
Good. They seem simple, but when you think about it, it's a little bit harder. That's fine. You did well. Do you happen to remember those 3 words that I gave you?
Table, basket.
Notebook?
Oh yeah, table, basket, notebook.
That's okay. 2 out of 3. You did very well. Okay. So I'm going to go over a series of stroke cards with you. Typically, these are used to rule out a TIA. Obviously, we're not expecting that here with you, but I do use these just as part of the neurological exam.
Okay.
So I have a series of scenarios, I guess we could say. Can you tell me if anything about this picture appears abnormal to you? Anything that you would say is concerning?
The sink's overflowing. The kid's about to fall.
Good. Okay, very good. I'm going to have you point to a couple things here. So can you point to the key for me? Good. Can you point to the object that you would use to sit down? Very good. And can you point to one item you would find outside? Very good. Okay. All right, so lastly, I'm going to have you just read a sentence for me. If you can read this.
I got home from work.
Perfect. And here?
Near the table in the dining room.
Awesome. Okay, so no issues there. You did really well. All right. So just catch up on a couple of notes here. You were doing really well. We're almost done with your neurological exam. Okay, so I'm going to have you complete a couple of tasks for me. If I hold my finger out, can I have you touch your nose and then touch my finger as I move my finger around?
Okay.
So go ahead and touch your nose and touch my finger and touch your nose. Perfect. And we're just going to keep doing it. Good. One more. Very good. Okay. So no issues with that. All right, so we can go ahead and move on to the physical portion of your examination. So is it okay if I go ahead and touch your face a little bit? Okay. So beginning with your range of motion, I'm going to test your head and neck essentially. So I'm going to just basically touch either sides of your face. I'd like you to allow me to manipulate you. I'm essentially testing how far you can turn your head, okay?
Okay.
So we're going to start by turning towards me. Any pain there?
Nope.
We can go the other way. Any pain there?
No.
Go ahead and go as far back as you can. Good. And as far forward. Any discomfort with that?
None.
Okay, so you did really well there. That's good news. Okay. So I'm going to do something similar with your arms, okay? So I'll take your hand here, and I'm just going to test the mobility and flexibility of your upper extremities here. So any pain or stiffening of your joints at all?
No.
Good, okay. Beautiful nails. Very good. And while I have your fingers, I'm just going to test your capillary refill, making sure that your blood is flowing appropriately. Very good. I'm going to do the same thing on this side. Good. Good. Perfect. If I can have you hold your hands out for me and then raise them above your head, and then if you could cross your chest like this. Perfect. Any discomfort with any of that? Nope. Good. Very good. Okay. So I'm going to do a quick test of your pupillary reflexes. So essentially what that's going to entail is me using a pen light to just test the reaction of your pupils.
Okay.
So just very brief, it is a little bright, okay? So I'll have you just look at a fixed point across the room for me. And I'm just going to slowly bring the light into your vision. You have beautiful eyes. Okay, good. Can I have you look all the way towards me? Good, and look up. Okay, and I'm just going to very gently hold your eyelid here if I can have you look down. Perfect, okay. All of that looks good. Apologize about the ambulance. My office is very close to the emergency room.
That's okay.
Okay. All right, Jen, so I'm going to do a bit of an orbital examination. So I'm just going to use my ophthalmoscope, which is this device here, to have a look inside your eye, okay? So just coming a little bit closer. Okay. So just looking at the inner properties of your eye. Actually going to just stand up for just a second. Towards me, please. Good. So I'm going to hold the bottom of your lid and I'll have you look up. Good, okay. So ocular anatomy is all intact. So that is great. Do you ever have any issues with your eyes as far as excess dryness, excess tearing?
No.
Good. Okay. Okay, so let's go ahead and move on. And I'm going to test your visual acuity. Now I have a Snellen chart here. Are you able to see this?
Yep.
Okay. Can you read that top letter for me?
A.
Good. Second line.
FP.
And what is the lowest line that you can read?
The bottom one.
Okay.
PEZOLCFTD.
Perfect. Can I have you occlude one of your eyes for me and read the lowest line that you can?
PEZOLCFTD.
Perfect. And the other side?
PEZOLCFTD.
Very good. 20/20 vision in both eyes. That's great news. When is the last time your contact prescription was updated? Has it been the same for a while?
Yeah, it was within the year.
Okay. Very good. Have you ever been tested for color blindness or color deficiency?
Yeah.
You have. Who did that?
The optometrist.
Okay. And was it a negative indication? Did they find that you were in fact colorblind?
No, it was negative.
Okay, good. So I just have a couple colored pens here, and I'd like you to just indicate the color for me.
Okay. Blue.
Good.
Pink. Purple. Green. Yellow. Red.
Very good. Okay, so no issues with that. And I'm going to use the red pen to test for your blind spot. So testing your peripheral vision, everyone has a natural blind spot. So basically I'm going to move this around in various areas. I'd like you to just let me know when you can see it. So when it appears and then when it disappears.
Okay.
Okay. So can you see it here?
Yes.
Perfect. So just let me know when it disappears.
Neil.
Reappears.
Neil.
Disappears.
Neil.
Good. And reappears.
Neil.
Good. Disappears.
Neil.
Good. Reappears.
Neil.
Good. Disappears.
Neil.
And reappears.
Neil.
Good. Disappears.
Neil.
And reappears.
Neil.
And lastly.
Neil. Yeah.
Very good. Okay. So all of that was well within normal limits. Okay. So we can go ahead and move on. And what I'm going to do next is a couple palpations of your lymph nodes. So we have chains of lymph nodes that run kind of on the sides of our jaw, so behind our ear, underneath our jaw, as well as along the clavicle or collarbone. And I'm just going to be manipulating them with my fingers.
Okay.
Okay. So just relax for me. If you feel any tenderness anywhere, please do let me know.
Okay.
So just feeling the first chain of nodes here along the sides of your neck. Okay. So far not feeling any swelling. Good, okay. So I'm just going to feel along the clavicle here. Good, okay, so feeling across the chest wall on this side as well. Good. If I could have you swallow for me. Very good. Okay. All right, all of that looks normal. Thank you very much. Okay, so I'm going to do a bit of a lung and heart assessment if that's okay. So I'm going to get my stethoscope out and listen to your heart first.
Okay.
Okay. Okay, so just going to place this in various areas. It is a little bit cold.
Okay.
Just breathe normally for me. Good, okay. Very good. So I'm just going to go at the top of your bra here. Very good. Good. Oops, sorry about that. So heart sounds are strong. I'm just going to listen to your breathing. Bowel sounds are active. Did you have anything to eat this morning?
No, not really.
So I do hear your stomach growling just a little bit. You ever have any issues with digestion?
No.
Okay, good. Okay, all of that sounds very good. So what I'm going to do, if I can have you sit up straight for me so I can listen to your back. Good, so I'm going to have you take a deep breath in every time I touch you with the stethoscope, okay? Good, okay. All right, Jen, you can go ahead and relax for me. All of that sounds really good. So no issues with your heart or your lungs. Bowel sounds were active. Your stomach is growling just slightly, which is totally normal. And everything sounded good. So no concerns there. Okay. All right, so we'd like to do a brief hearing test, if that's okay with you. So just very brief test of your hearing. Obviously, you can hear me conversationally. If you have any difficulty hearing anything, we might need to get you over to an otolaryngologist or an ENT who can have a look in your ears. Okay. Do you ever have trouble with your hearing?
No, not really.
No? Okay. So I'm going to test just a couple things, nothing major. So I'm going to start by making sounds with the glove. So if it's okay with you, I'd like you to close your eyes and just say yes when you hear it, okay?
Yes. 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 Yes.
Good. So I'm going to do the same thing. If you can tell me where it starts and where it stops, okay?
Okay. Left. Right.
Good.
Right. Left. Left to the right.
Good. Okay. So I'm going to test again. This time you're going to hear a slight squeaking or like a puff of air. Okay. I'd like you to tell me where you hear it, okay?
Left. Left. Right. Left. Left. Right. 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 Top, like center.
Good.
Left. 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 Back.
Good.
Right.
Good. Very good. So you were able to hear even the quietest noises. So that is good news. So let's go ahead and move on to a test of your nasal patency. I know you said you were having a little bit of trouble with your seasonal allergies. So I'm going to occlude either side of your nostrils. I'd like you to just take a breath in and let me know if you have any difficulty there, okay? So go ahead and breathe in for me. Good. And on this side. Any difficulty? I did hear a little bit of stuffiness there.
A little tiny bit.
Not too bad.
Not too bad, no. Not like it has been.
So let's go ahead and do a test of your olfactory nerve. So this is a cranial nerve that controls your sense of smell. So I have a couple objects here that are pretty common smells, things that you should have smelled before. I'd like you to just try to indicate what they are. Okay. Starting with this first one.
It's like tea tree?
It is tea tree. Very good. This one here.
It's like citrus?
It's orange. Yeah.
Lemon?
It is lemongrass. Good job. Some people get stumped between the lemon and the orange, so you did well. Okay. So let's go ahead and move on. So I'm going to do a very brief oral examination, if that's okay. Obviously, I'm not a dentist. I just want to have a quick look. Are you having any difficulty with your teeth or your gums?
No.
Do you see a dentist regularly? Okay. So if I can have you just open up for me. Good. If you could bring your tongue up. Perfect. And stick your tongue out and smile for me. Good. Okay. Beautiful teeth. So I'm just going to have you stick your tongue out for me. At the back of the throat, if you could say ah. Perfect. Okay, uvula is midline. Very good. Very healthy. That's what I like to see. Okay, so let's go ahead and move on. because you're a first-time patient, I would like to perform a very brief sensory examination.
Okay.
Have you ever had your sensory perception tested? So like
No.
the ability to feel different stimuli?
Mm-mm.
Okay. So I have a couple different tools that I'll be using. Let's see. I'm going to test a couple different things, essentially testing your ability to feel various textures, sensations, temperatures on the skin. I'd like to start by testing on your face. Okay. So I just have a little kind of soft cotton wisp here. Can you feel that this is soft?
Mm-hmm.
Okay. So this examination is going to be performed with your eyes closed. Okay. I'm going to touch your face in various places. I'd like you to just indicate when you feel it.
Kneel. 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 Kneel.
Good. So moving down.
Kneel. 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 Kneel.
Very good. So I'm going to do a variated test here. So I'm going to use the same tool, and then I have this tool that is rather sharp.
Mm-hmm.
It will not pierce the skin, but you should feel a distinct sharp sensation. Okay.
Oh, yeah.
So if you can just indicate either sharp or dull or sharp or soft, whichever you prefer.
Sharp. Sharp. Soft. Soft. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Soft. Soft. Sharp. 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 Soft. Soft. Soft.
Good. Okay, very good. So I'm going to have you hold your hands out for me like this. You don't have to close your eyes, but I would like you to let me know as I trace your fingers if there are any areas that feel slightly numb or just not as distinct, okay?
Okay.
Does that feel the same?
Yeah, just about.
Feel the same? And it felt the same on both sides?
Yeah.
Good. Okay. Similar test, this time I'm going to touch you with two sponges. They are identical. I'd like you to tell me if it feels different on either side, okay? So go ahead and close your eyes for me.
Same. 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 Same.
Good. Okay. And so moving on, I'm going to test your ability to feel cold sensation.
Okay.
So I'd like you to just indicate when you feel cold.
Okay.
Okay.
Now. 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 Yep. Yep. Yep.
Very good. So you did not miss anything there. The very very last thing is I'm going to test your ability to feel vibration sense. So I'm going to test bone conduction. So I'll be putting this on one of your knuckles as well as on your wrist and then the back of your ear. Just let me know if you feel vibration.
Okay. Yeah.
Good.
Yes. Yep. Yes. 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 Yes.
Very good. Okay. So you did really well with all of those. And I am going to do a quick test for peripheral neuropathy. So I just have a little brush here. I'm going to stroke certain areas. Now the difference with this examination is that you should be able to feel it. I'm looking for a very specific pain response. So if I stroke this across your skin and you feel a pain sensation, please let me know.
Okay.
Any pain with any of that?
No.
Good. If I can have you flip your palms for me. Now I'd like you to just look across the room for me. Try not to pay attention to what I'm doing here, okay? Good. Okay, very good. Okay, so let's go ahead and move on. So I am going to lie the table back a little bit if that's okay with you. I'll have you lay down for me. Perfect. So go ahead and adjust yourself to what's comfortable. Does that feel okay? So I'm going to start with a bit of a brief abdominal examination. So just going to start with the visual inspection with my light. So I'm going to start by having a look at your respiration. So just breathe normally for me. Just assessing the movement of your rib cage as you inhale and exhale. Good. Okay. Are you comfortable with me lowering your pants just a little?
Yeah, good.
Okay, so just having a look at the umbilical area, looking for any signs of distension or umbilical hernia, which I'm not noting. Did you have your navel pierced at one point?
Yeah.
Okay. Any issues with the healing of that piercing?
No.
Okay, good. Good, okay. So I am going to listen to your abdomen again with my stethoscope. So now that you're laying flat, I will be able to hear a little more in depth. So just breathe normally for me. Okay, so now while I listen, I'm going to tap gently with my reflex hammer, okay? Shouldn't cause you any pain. good. So I'm going to continue my examination. So I'm going to go ahead and palpate your abdomen. I will start with more superficial palpation, so not pushing so hard just to begin with, okay?
Okay.
So just feeling around. Initially just feeling for any signs of distension or abnormal bloating. Around for any signs of hernia or any abnormal lumps underneath the surface of the skin. Okay, so palpating just slightly deeper now. I'm feeling for your abdominal organs, feeling your intestines. That feels normal. Good. Okay. Okay, so I'm just going to tap around briefly here. Let me know if any of this causes you any pain. Okay. Just tapping along the bony prominences. Okay, very good. And similar to before, I'd like you to just indicate if you feel cold sensation, okay?
Okay. Yes. 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 Yes.
Good.
Yes.
Does this feel any different as I move down?
No, it feels about the same.
If I move across, are there any areas that feel numb at all?
No.
Good. And do you feel vibration here?
Mm-hmm.
And here?
Yes.
Good. If you could indicate when you feel soft.
Okay. Now. Yes. Yep. Yes. 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 Yep. Yes. Yes.
Any difference as I move down here?
No.
None of the areas feel numb at all.
No.
Very good. Okay. All right, Jen, we are just about done with your examination. The very last thing I'm going to do is a test for your lower limb mobility.
Okay.
So similar to what we did with your arms, I'm just going to manipulate your lower extremities, move your legs around a little bit.
Okay.
All right, so I'm just going to move this protective cover here. So having a look at your hip placement in comparison to your rib cage. So I do see a natural widening at the hips, which is what we like to see. It does allow for better posture. Do you ever have any pain or discomfort in your legs at all?
No.
Okay. Good. Okay. So if I can have you bring your leg up with bent knee, perfect, as far as you can. Any discomfort there?
Nope.
We'll do the same thing on the other side. Did hear a slight
Yeah.
popping there. Any discomfort there?
No.
Okay, good. So I'm gonna have you bend this leg again and bring your leg in like this. Perfect. And we'll do the same on the other side. Good. And then if I can have you drag your heel from your knee to your ankle there, so across the front of your leg. So if you can bend
like that.
and go down like that, but rub across your leg. Perfect. And if you can do the same on the other side. Okay, good. So no issues with that either. Do you ever have any pain in your hips?
No.
Okay, good. So I'm just going to check for hip displacement. So just essentially checking to see if there's any abnormality here. Okay, so all of that looks good. Okay. All right, Jen, well, we have completed your examination today. You did really well. So the good news is I found absolutely nothing that was abnormal. Okay, so the only thing we're waiting for at this point is your blood work. So typically 48 hours is about average for it to come back. So I'll test your urine sample as well as the buccal swab that the nurse took. Did she talk to you about your patient portal already?
Yeah,
and
she
you're
did.
signed up for that? Okay. So when the results come in, you will get a notification that says you have labs that are available. They will not populate for you to read them until I call you.
Okay.
So I'll give you a call within 48 hours. If I don't call you for whatever reason, you are welcome to call me and we can go over those results.
Okay.
Okay. All right. Do you have any questions for me?
No, I'm good.
Okay. All right. Well, we are good to go. I will give you a couple minutes to get dressed. Okay.
All right, thank you.
Thank you so much. Have a good day.
You too.